Today, there are three main types of treatment to fight cancer: surgery, chemotherapy, and radiotherapy. Unlike traditional radiotherapy that uses photons to irradiate and kill tumor cells, proton therapy is an advanced form of treatment using protons. These particles give proton therapy its many advantages. Proton therapy's greatest advantage over conventional radiation therapy is its accuracy and its ability to spare healthy tissues. Protons, however, have a particular physical property called the Bragg peak. They're able to deposit less energy on their way to the tumor and do not affect tissues beyond it. This property allows to confine the radiation dose to the tumor and radically decreases the risk of injury to surrounding healthy tissues. The proton originates from the ion source, where hydrogen atoms are separated into electrons and protons. The protons are injected into the cyclotron, where they're accelerated. Then, these high-power protons are sent through an energy selection system and a degrader that adjust their energy. The beam transport system conducts the protons with the right energy and trajectory. Then the proton beam arrives in the treatment room via a gantry. The gantry revolves 360 degrees around the patient so that the beam can be delivered at any angle. A high accuracy of patient positioning is required. IBA's treatment rooms are equipped with the latest patient positioners, alignment, and imaging systems to ensure the reproducibility of patient positioning. Today, proton therapy patients have access to a state-of-the-art delivery mode called pencil beam scanning. The beam is steered across the target volume one layer at a time, pixel by pixel, to precisely match the shape of the tumor. With this active scanning technique, the physicians are able to change the proton dose at any specific location in the target. This allows proton therapy to adapt to very complex-shaped or moving tumors, improves the dose conformity, and reduces the integral dose of radiation given to the patient. Proton therapy is changing the way you treat cancer.
LDR brachytherapy. Brachy means close and refers to the short distance between the radiation source and the tumor tissue. LDR brachytherapy, small radioactive sources called seeds, are permanently implanted in the prostate and thus directly into the tumor. In contrast to the nerve-preserving surgery, this procedure also easily allows the treatment of the area surrounding the prostate and thereby enables a significant improvement of the chances of recovery.
After general anesthesia and the rectal insertion of an ultrasound probe, 2 fixation needles are placed to stabilize the prostate in the desired position for the treatment. The prostate and the surrounding tissue are then recorded in layers using the probe. With the help of the ultrasound images, the physician can determine the exact contours of the prostate and the surrounding regions. Based on the determined size and shape of the prostate and adjacent organs, the physician can now calculate the exact number of seeds required and their optimal positions within the prostate with the help of the treatment planning software. According to the treatment plan, seed chains, which are linked seeds, are then prepared and transferred into implantation needles. The radiation exposure of the medical staff during this step is low. The doctor guides the implantation needles into the prostate with the help of a guide called a template grid and inserts the seed chain through them. The exact positioning of the seeds is determined simultaneously with the help of ultrasound and, if necessary, fluoroscopy. The recommended prescription dose of 145 Gray is administered precisely internally, with a safety margin around the prostate.
HDR brachytherapy, precise tumor targeting. High dose rate brachytherapy is a well-established form of internal radiation therapy that uses a small radioactive source positioned directly into or around the tumor for a short period of time. The treatment is conducted with a computer-controlled HDR afterloader. The source is quickly driven from a shielded safe, through transfer tubes and applicators and positioned accurately to irradiate the tumor. In the case of a nasopharyngeal tumor, a special silicone applicator guides the source alongside the tumor in millimeter increments. Prior to the treatment, a designated treatment planning system is used to calculate the exact source positions and dwell times to ensure an optimal dose distribution to the tumor. After the treatment, the source is driven back into the shielded safe of the afterloader. HDR brachytherapy is applicable to numerous body sites. Its precise tumor targeting enables short treatment times and spares the surrounding healthy tissue.
Lexel Gamma Knife radiosurgery uses ionizing radiation to damage the diseased tissue beyond repair by disrupting the DNA structure in the cells. The type of radiation used in Lexel Gamma Knife is gamma radiation emitted from a radioactive isotope of cobalt known as cobalt-60. Because each cobalt source is very small, only 1 millimeter in diameter, and close to the target in the patient's brain, it provides superb precision for brain radiosurgery. Tungsten and lead shielding prevents unintended transmission of radiation and ensures the safety of patients and hospital personnel. The cobalt sources are arranged into 8 movable sectors inside the radiation unit surrounding the patient. A sophisticated beam shaping system with fixed channels, called collimators, is used to create narrow beams of radiation, all precisely focused to intersect at the planned isocenter. The size of the beams can be adjusted by independently moving the sources in each sector to one of 4 available collimator positions, creating beams of 4 millimeters, 8 millimeters, or 16 millimeters in diameter. When treatment is paused or completed, the sources are moved into a shielded position, the closed collimator position. The radiation beams are precisely focused to intersect at a single point called the isocenter. This is accurately positioned within the clinical target to achieve a maximum dose to the target while ensuring minimal dose to healthy tissues. When performing radiosurgery in the brain, it is important to prevent any movement of the patient's head. A frame or a mask system is used for this purpose, ensuring that the planned treatment is delivered accurately. An integrated ultra-low-dose cone beam CT imaging system is used to verify the patient position and adapt the treatment plan at the time of treatment. The treatment plan is automatically adapted to the target position by co-registration of pre-treatment cone beam CT images to reference images. Dose evaluation allows for online review of the delivery adaptation so that the planned dose distribution is delivered as intended. During treatment delivery, the patient position is automatically adjusted to new isocenter positions, and the collimator sizes are changed without the need for any user interactions. The shape of the beam is adjusted, and by placing multiple isocenters within the target, the dose is built up to tightly conform to the target shape. During treatment delivery, the patient position is automatically adjusted to new isocenter positions, and the collimator sizes are changed without the need for any user interactions. The shape of the beam is adjusted, and by placing multiple isocenters within the target, the dose is built up to tightly conform to the target shape. The infrared high-definition motion management system tracks the patient movement using markers on the patient's nose to monitor movement of the patient during treatment in real time. Should the patient inadvertently move during the treatment delivery, the system ensures that the treatment is automatically paused. Once the treatment is completed, the collimator returns to the closed position. The patient is automatically moved from the treatment position, and the shielding doors are closed.
How the linear accelerator works. Accurately produces, monitors, controls, and conforms the radiation beam to the planned target. Beam generation. Radio frequency waves are pulsed into the waveguide by the magnetron. This is synchronized with the injection of electrons into the waveguide by the electron gun. The radio frequency waves accelerate the electrons along the waveguide to a speed approaching the speed of light. The X-ray beam is created when the electrons hit and interact with a tungsten target at the opposite end. The magnetron controls the power and frequency of the radio frequency waves, which determine the energy of the X-rays produced. The digital accelerator uses a diode-type electron gun situated at the end of the waveguide. The electrons are produced by heating the tungsten filament within the cathode and are then injected into the waveguide. The number of electrons injected is controlled by the temperature of the filament. The electrons are accelerated along the waveguide toward the target. The waveguide contains a series of copper cells. Small holes, or irises, between these copper cells allow the electrons to travel along the waveguide and help to focus the beam. A vacuum is created to ensure that the electron beam is not impeded by other particles. The path of the negatively charged electron beam is controlled by two sets of quadrupole magnets, called steering coils, that surround the waveguide. An additional two sets of focusing coils help to further define the electron beam so that it is very fine, with a diameter similar to that of a pinhead when it hits the target. The entire system is cooled by water. The electrons exit the waveguide and enter the flight tube, where the beam is redirected towards the target. The electrons travel along a slalom path within the flight tube. 3 pairs of magnets on either side of the flight tube cause the electron beam to bend through the turns of the slalom. This process not only positions the beam to strike the target, but it also further focuses the beam to a diameter of 1 millimeter. The design of the magnets enables them to focus electrons of slightly different energies onto the same point on the target. This is called achromatic behavior. This slalom bending is unique to electrolinear accelerators. It helps to minimize the size of the machine and ensures that its isocenter remains low, which is important for patient setup. The high-energy electrons hit a small tungsten target where the electron energy is converted into photons, or X-rays. The high-energy photons emerge from the target in a variety of directions. The primary collimator only allows forward-traveling X-rays to pass through, creating a cone-shaped beam. The primary collimator minimizes leakage, and therefore excess total body dose, by absorbing scattered X-rays traveling in the lateral direction. It also defines the maximum size of the resulting clinical radiation beam. At this stage, the photons are not uniformly distributed across the beam, and so a flattening filter is placed in the path of the beam. The cone-shaped filter absorbs more photons from the center of the beam than from the sides, creating a uniform photon beam. The dose delivered to the patient is measured and controlled simultaneously in 2 independent ionization chambers. One chamber is the primary dosimeter. It measures the radiation and terminates the beam when the required dose has been delivered. The secondary ion chamber acts as a backup and will stop the irradiation if the primary chamber fails. The X-ray beam is almost ready to treat the patient. Before that, further beam shaping is required to ensure that the shape of the delivered X-ray beam matches the shape of the tumor. This is done using a multi-leaf collimator, a number of fine tungsten leaves which move independently of one another and can create a variety of complex treatment shapes. One computer system controls both the Linac and the multi-leaf collimator. This eliminates dosimetric errors due to communication delays. It also ensures synchronization between the delivered dose and the multi-leaf collimator position, allowing complex deliveries such as intensity-modulated radiation therapy and volumetric modulated arc therapy. All electromagnets, steering, and focusing coils are digitally controlled. All mechanical positions of flight tube, filters, and foils are automatically selected from the control console, and all radiation beam settings are grouped in calibration blocks for each energy. These are stored digitally on the Linac hard disk for flexible and easy beam adjustment, calibration, and servicing. Clearance. Clearance is the free space available under the Linac for patient treatment, and it varies with different protocols and fixation devices. It is a combination of the distance between the lower surface of the radiation head and the isocenter, 45 centimeters, and the head diameter, 62 centimeters. A wide clearance around the isocenter means improved access for patient setup, freedom to use the best possible patient positioning and immobilization accessories.
CyberKnife, the first and only robotic radiation system. Using advanced imaging and real-time motion synchronization, the CyberKnife system continually verifies the tumor's position, automatically correcting and adjusting for even the slightest movement. Because of its unique robotic design and image guidance technology, no invasive head frame is required in the treatment of brain tumors, allowing the patient to rest comfortably and breathe normally. The CyberKnife system delivers multiple beams of radiation from various angles to destroy the cancer cells regardless of the tumor complexity and location. The CyberKnife system is non-invasive and non-surgical. Its unique robotic movements and pinpoint accuracy enables your physician to approach the tumor from the best possible angle, delivering precise high doses of radiation directly to the tumor without any surgical cuts. Not only does this mean no overnight hospital stay, but it allows for short treatment and recovery time. Patients can experience limited to no side effects and can continue on with their lives even on treatment days. The CyberKnife system offers an improved quality of life when compared with other treatments and surgeries. The sub-millimeter accuracy with which the CyberKnife system delivers radiation to brain tumors can also be applied to tumors of the head and neck, spine, lung, breast, prostate, liver, pancreas, kidney, and more. The CyberKnife system is clinically proven and has been used to treat hundreds of thousands of patients. It is also safe and effective when used in combination with a variety of other techniques, giving new hope to patients with recurrent tumors, even those which